My name is Urs von Holzen. I'm the Director of Surgical Oncology at the Goshen Center for Cancer Care. I went to university and medical school at the University of Zurich in Switzerland. I did residency at the University of Basel in Switzerland as well. My fellowship training was for 2 years at MD Anderson, doing a research fellowship. And then I did a surgical oncology fellowship at Fox Chase in Philadelphia. And I did a thoracic surgery fellowship at the Brigham and Women's Hospital at Harvard in Boston. I chose surgical oncology because it's a very challenging field, and you form long-lasting relationships with your patients. So it's a very rewarding field. We have a wide range of patients that we see at the cancer center. Essentially, any tumor that needs an operation is seen at the surgical oncology department. Personally, I see a lot of lung cancers. I see a lot of upper GI cancers, pancreas, liver, esophagus, and gastric cancers. We have a very large minimal invasive surgery program, laparoscopic, thoracoscopic, robotic. So we can do all of these procedures with small incisions, cameras. It's all about the right indication for the right patient. I think it's important for referring providers, as soon as they think cancer, refer the patient to a cancer center. It's not just a treatment decision, sometimes it's actually the workup decisions as well that are very important. Depending what the tumors are or what the suspicions of tumor are, a specific workup is necessary. That includes knowledge of what the treatment will be later, so we don't burn any bridges while we're doing the workup for these patients, especially when it comes to invasive procedures or biopsies. For a preoperative workup or anything, it's more important to do the right things at the right time than the wrong things immediately. So in that regard, it's all about communications and going back to the referring providers and tell them what we need to have to make a meaningful discussion with the patient. We have separate tumor boards essentially every day. We have a GI tumor board, we have a GYN oncology tumor board, we have a thoracic lung tumor board, we have breast cancer tumor boards. So we have several of them. The goal clearly for any cancer patient is a multidisciplinary treatment planning. So every cancer patient should be discussed in a multidisciplinary fashion in a team where all the different providers are there. Goshen Health has a very unique cancer care team. We have one of the largest surgical oncology team in the state. So we have a lot of surgical firepower. There's not many operations that we cannot do in Goshen in our cancer center based on the training that we have. It's unique in the area to have such a surgical knowledge that we have here in our team. We're very used to work with outside providers, being primary care doctors, being other oncologists, other specialists that refer patient to us. We'll guide the workup, we'll guide the treatment planning, and we'll get back to the referring providers very quickly with information about their patients.